Alright, today we're gonna talk about shoulder dislocations, why this super common injury is a much bigger deal for young active people. And more importantly, why the very first time it pops out is a massive warning sign that you can't ignore. The human shoulder is by far the most mobile joint in our entire body. It let us throw a ball, reach something on the top of shelf, you name it. It has that incredible range of motion. And my dear, every advantage you got in your body, there is a disadvantage in the opposite, which is instability in our case. We'll kick things off with the shoulder dislocation fundamentals and what is the most appropriate management for you to do, especially if you're an athlete. If you take a closer look on the shoulder's anatomy, you'll find that the shoulder relies on less bone and more soft tissue than any other major joint. That means the shoulder relies on something or structure that can stretch and tear more easily. So that takes us right into section 2. If you really want to understand why the shoulder is just so wobbly, you've got to take a look at its basic design, the problem itself. As you're about to see, there are two main parts here. The humerus, that's the ball at the very top of your arm bone, and the glenoid, which is the socket in your shoulder blade. Better way to picture it. Think of a golf ball sitting on a golf tee. There's just not a lot of bone to hold it in its place. So you might be asking, if the bones aren't doing the job, what is? Well, that's where the labrum comes, the most important structure of the shoulder. It's a ring of tough cartilage that acts like a bumper around the shallow socket, making it deeper that plus your ligaments and rotator cuff muscles to keep it in its place. So the labrum physically blocking the ball from just slipping out, but it also does something crucial. It creates a suction seal that really helps hold the whole joint together. When that bumper gets torn, the entire system just starts to fall apart, which is the perfect lead to section 3. What is actually going on when that system fails and the shoulder dislocates? Well, it's a pretty traumatic event and causes direct physical damage to the soft tissue we were just talking about. There are two main ways this can go down. Either a complete dislocation, well that one is obvious. The ball is completely out of the socket. It hurts like hell, and your shoulder looks visibly out of place. On the other hand, there is a partial dislocation. That's where the ball slips part of the way out, then pops back in. It's still doing damage every time and paving the way for bigger problems later. The dislocation we see more often is an anterior dislocation. Just picture a quarterback winding up for a throw or a swimmer reaching overhead. That's the vulnerable position. It almost always tears the labrum right off the front of the socket. And that specific injury has its own name, and it's called the Bankert lesion. Okay, I need you to really listen here, because this is the absolute core of our entire explanation. Why does this exact same injury act so differently depending on how old are you? For young people, a single dislocation starts ticking clock. Take a look at this number. Just let it sink in. Nearly 100%. What in the world could that possibly be referring to? That's the risk of it happening again. If you have the first shoulder dislocation before you turn 20, the chance of it happening again maybe 100% and maybe more. No, I'm just kidding. It's almost a certainty. This chart just lays out in black and white. For someone under 20, the risk of it happening again is a staggering 95%. But look at what happens if you're over 35. The risk plummets to less than 10%. We're talking about two different injuries depending on your age. The big question is why? So why the huge difference? In younger people, their tissues are just more elastic, more stretchy. So when that labrum tears and the ligaments get stretched out, they just don't heal back magically into their right place. They heal, but stretched out away from the bone and the socket itself. And each time you dislocate your shoulder again, it grinds and take more cartilage and bone, seriously increasing your risk of arthritis. So if you got a structural problem, you need a structural fix, which brings us to section 5, surgery. And let's be clear, this is not about managing pain or getting by. It's about actual rebuilding the joint. Physical therapy is absolutely crucial for recovery, no doubt about it, but it has its limits. It's good only for strengthening the muscles, not fixing the problem itself. You cannot physically reattach a torn labrum to the bone. The underlying structural problem is still there. On the other hand, the surgery goes right to the source of the problem, fixes the torn labrum, and tighten up the ligaments. This surgery is simple and performed with the least invasive methods. During surgery, the surgeon finds the torn labrum. It is usually hanging loose, then placing small anchors into the bone and suture the labrum back exactly where it belongs. And finally, the stretch joint capsule and ligaments are folded and tightened. Understand, this isn't just about getting over an injury. It's about making decisions that can impact the rest of your active life. All the evidence really points towards getting this fixed early. Anyways, all the evidence really points toward fixing this early to prevent the whole cascade of future injuries. But as this quote says, it always comes down to you, who you are and what you want to do. Your goals matter. If you're an athlete or a sport guy, your calculation is going to be very different from someone who lives more sedentary life. The real question isn't only how do I heal, it's how do I stay stable for a long period of time.